Hi, welcome to another edition of Matters of the Heart, brought to you by Haverhill Community Television and Pentucket Medical Associates Cardiology. I'm Dr. Seth Bilazarian, a cardiologist with PMA in Haverhill, and I'm delighted to be here with my colleague, Dr. Kenneth Adams. And Dr. Adams has chosen a topic that I think comes up frequently for us with our patients, is an audience favorite. We've covered it a few times in the past, and he's going to update us on the issues around vitamins and cardiovascular disease. What's known about the status of vitamin supplementation, and should we do it? Should we not do it? What's the best recommendation? So take it away, Dr. Adams. What do we know about vitamins and cardiovascular disease?
Thanks very much. I find this an interesting topic because so many of my patients, and I'm sure your patients, come in and we go through their medication list with them, and they're on 3 or 4 cardiac meds, and I said, is that all? Is that the only, are you taking anything else? Oh yeah, I'm taking vitamin E, vitamin B, vitamin C, vitamin D. Oh, how come? Why are you taking those? And I became even more interested because one of the news shows just recently had 2 national experts talking about vitamins, the whole debate. And they actually, to my pleasure, came down against most of the vitamin supplements. And I thought it was a very reasoned presentation.
I think our audience might just change the channel now since you gave away the conclusion.
But I'll try to explain why I mean that. So there's something called a U.S. Preventative Task Force Service, and they recently came out with a number of recommendations. They said, number one, that dietary supplement use remains very common, and there are many advertisements making promises of reducing heart disease and cancer. So this goes beyond our field. It goes into the cancer field as well. And they pointed out that between 2007 and 2010, and I'm sure the same now, half of the people in the U.S. have used some kind of vitamin supplement. So 1 out of 2. So if every 10 people you look at, 5 people have used a supplement at one time or another. Then this next number really astounded me. So they said that there was $28 billion spent on dietary supplements in 2010. So not million, $28 billion. Because one of the things that I kind of flippantly say to my patients in the office when they say, well, I'm taking vitamin E, I'm taking this, I'm taking that, all these supplements, I say, how come? He says, well, I think it's doing good for me. I said, well, it's quite possible that the only one it's really doing good for is the people who run the GNP stores, who are selling these vitamins. But then we go on to have a little more discussion about it. This task force said that for the most part, the data is insufficient to say whether there's any benefit or, on the other hand, any harm. The only supplements that they felt there might be harm for was something called beta-carotene, where they thought that beta-carotene insusceptible patients, people at high risk, might develop more lung cancers than people not taking beta-carotene. So of all the supplements people use, that was the one that they identified as something that might have a very negative impact. What they recommend is that we try to relate to patients that taking supplements may not be beneficial. And I'll try to go through some of the recent evidence that I saw. In general, you probably should concentrate on having a good diet. Portion control, low fat, whole grains, nuts, fruits, vegetables. Just a healthy lifestyle diet, and try to get into an exercise program if that's appropriate, given other aspects of your health. Now, you could argue that there's some biologic plausibility that people should take some supplements. For example, everyone seems to be getting their vitamin D checked, and lots of people around here are low in vitamin D. This is a place where we go through a long winter without much sunshine. Sunshine stimulates vitamin D. And if your vitamin D is low, that starts a whole inflammatory process. It starts this hormone churning called parathormone, which tries to make your calcium count go higher, and it's a stress response. And we know that inflammation and heart disease are linked. So presumably there's a link between vitamin D and heart disease. So the question is, and I'll try to answer that a little bit later, is if you have deficiency of vitamin D and you take vitamin D supplementation, is that going to help you? Is that going to reduce your risk of heart disease? The other problem is that it's very difficult to come up with clinical trials big enough to prove whether a vitamin works or not. The changes from taking a vitamin, if they're present, may be very, very small. So you need thousands and thousands and thousands of patients. So these studies get to be very, very, very big and very, very expensive. So it's hard to do them. The other interesting thing that the task force presented was that we don't have a great idea about what normal vitamin levels are. You know, we know that for vitamin D, for example, you should have a level over 30, and that would say that you're not deficient. But we don't know for sure, and we're not totally sure about what the normal daily requirements are. You know, we see on all these, on foods and on diets, you know, it provides 20% or 30% of your normal daily intake, but of course that's based on your age, your size, and the presumption that we know what the average is.
I guess if I could just make a brief comment about one of the things that you said that I agree with completely, and it seems like there's a sort of American cultural bias towards taking a pill versus taking something that might be healthy, like a whole food. So we've seen that based on population-based studies, that populations that eat more fish than meat have a lower rates of heart disease.
Right.
So instead of saying, well, let's adopt that, people have said, well, I'll just take fish oil and I'll keep eating my meat, which is probably not very likely to be beneficial like eating fish, because if you eat fish, it means you're not eating meat. So just to say, well, it must be the fish oil, I'll take a fish oil pill and eat the meat, is an example of how I think that this can go awry. Similarly, people have tried to extract the one thing that might be beneficial in red wine, so people will take that compound as an example. So there's a variety of examples like this that I think that people can sort of try to say, well, I want to retain many of my unhealthy things, like not eating fruits and vegetables, not eating whole foods, not eating processed foods. I want to keep doing those unhealthy things and supplement with something that might be of benefit. And I think what you're saying is, what I try to emphasize is that there's really no data that it works. Patients have the bias. I'm not sure if you hear this from your patients, that doctors don't like vitamins. Right. And it's certainly not why we don't like vitamins. Show me a study that shows that if you give people vitamins of any kind, vitamin D, that it lowers the rate of heart attack or stroke, and I'll be the first in line passing it out.
A lot of interesting points that you raised there. I think that people just think if I take a supplement, I'll be healthier. And I don't necessarily have to exercise much. I can cheat on my diet a little bit. And I think the same is true for statins. You know, the cholesterol medicines, I think there was some recent publication that's saying that people with statins tend to eat a little bit more because they think that they're protected. Right. So, yeah, I do. I try to relate the whole healthy lifestyle discussion for my patients. Okay. I agree. So let me go through a couple of clinical studies that have come out relatively recently. There was one called the TACT trial, T-A-C-T. So this took a multivitamin supplement. It was a 28-component, high-dose multivitamin, multi-mineral. I mean, every supplement you could think of. So you would think that everything was covered. And it was compared with placebo. In other words, you know, a similar size pill, but it was a fake. So the question was, did this reduce cardiovascular events? Did it reduce the death rate from cardiovascular events? Did it reduce cardiovascular hospitalizations?
All good stuff we'd want to reduce.
Right, and no difference. No difference. And as I was saying that, I just wanted to make, you made another interesting point in your comments that people think doctors don't like vitamins. I almost think it's the opposite, because for a long time, we were prescribing a lot of vitamin B, because there was something called homocysteine in the blood that we thought might be linked to vascular disease. So we were among the highest prescribers of vitamins at that time. And then a couple really good studies came out, showed, you know what, it's not really doing any good, so we stopped. You know, people have taken zinc for colds because they think that it gets them over colds faster. A year or two ago, there was a study about that because we wanted to know, should we be prescribing or telling our patients like zinc? It made no difference. I think the longest discussion has been about vitamin C. It goes back to the days of Linus Pauling, the Nobel laureate for science, and he had recommended vitamin C as the cure for cold and lots of other things, and we still haven't really proven it. So I think I agree with you that, you know, we'd be the first to prescribe vitamins if we thought they had some good, long-lasting effect.
And in that same vein, I guess I would add, just to get your comment, is that patients have the impression that I want to do something natural.
Right.
And I don't think that it's appropriate to think of these as natural, right? These are made in chemical factories. So they
Right.
they may extract it from something natural, but it's not natural, number one. Number two, the biggest concern I have is that vitamins, many patients don't know this, but are not regulated by the FDA. Right. So they're often made offshore in other countries, some Asia, some other countries, other continents, and they may not be pure, so we don't know what else is in them. We don't know about their potency. If it says 500, it doesn't mean it's 500, because if you take a drug that's regulated by the FDA, they test to make sure that it has the right amount of milligrams. So we don't know about potency, we don't know about safety, we don't know about contaminants. There's been several cases of contamination in some supplements. Right. So I'm not sure it's natural, and I'm not sure it's safe. So it probably, I've even changed my tune to say, it's probably not going to hurt you, but it probably won't help you. Right. I'm not sure that's even appropriate. I might say it may very well hurt you, and it's no evidence it will help you. I guess that would be the...
And you know, I don't think we would have anything against something that was, quote, natural, although these vitamins aren't necessarily natural the way they're prepared. But you remember that one of the most famous cardiac medications, digoxin or digitalis, came from the bark of a tree. Uh-huh. How much more natural can you get on that one? And it's something we still use, you know, in appropriate situations.
Foxglove plant.
Exactly.
Yes.
So I want to talk a little bit more about vitamin D. I did mention that there were some studies that show a link between low vitamin D and cardiovascular events. So we think that that's true. So the question now is, but if I take vitamin D supplements and I get my level up to where it's supposed to be, whatever we have deemed that level should be, am I going to reduce my risk of heart disease? So this study reviewed 6 clinical trials of vitamin D, and only 1 out of 6 of these studies showed some benefit, and it was in a very specific patient population. The only benefit that was seen was in older black adults, 55 and older, and it seemed to, vitamin D seemed to bring about some reduction of systolic, the top number of your blood pressure. And that was really, of those 6 studies, that was the only benefit that was truly seen. And I think we're all very careful now about the whole cause and effect. So for example, with the vitamin D, your level's low, you have an increased risk of cardiovascular disease. Does taking the supplement help? I think you could make an analogy to cholesterol management. So we know, or we know that most of the time a lower bad cholesterol is better. So we were very gung-ho about a medicine called Zetia or ezetimibe years ago, because we knew that in addition to statins, it would lower your LDL, thinking if we lower that LDL further, we'll reduce your risk. And it turned out that even though we got a better LDL number, that medication didn't necessarily reduce cardiovascular events. So we don't want to jump in just because it looks like it might work. Right. We really want to have what we call outcome studies that say, yes, here's 10,000 patients with low vitamin D. We gave supplement to half of them and no supplement to the other half, and let's see what happens.
Right. I think that's your point is well made. I know you and I certainly talk about this a lot, but just to help, if I could add a couple of comments to what you said. So the thing that's often quoted in the literature is causality. So if you have a low vitamin D level, is it causing a problem or is it just a marker of problem?
Exactly.
So I'll just give an analogy of something else that recently was in the news. So about a week ago, there was a news in the lay press that if you take a nap that's longer than an hour a day, you have a higher rate of dying.
Right.
So is it because the nap caused the death? Or is it that people who are just very fatigued take a nap and it's something else causing the fatigue? I'm just trying to use this as an analogy to help understand the vitamin D. So the other, like in our area of expertise, one cause why a person might take a nap every day is a problem called sleep apnea. So if you have sleep apnea, you don't sleep well, you're tired all day, you take a nap, but the sleep apnea we think is really what's causing heart-related problems, not taking a nap. So that's an example of how we might be going down the wrong area with vitamin D. So
yeah, very clear, very good example. So as we often do with studies, so we do a study and it says maybe there's a little benefit for one group, like these older black patients who had a little bit of reduction in blood pressure with vitamin D. So the next study was called VITE-DISH, V-I-T-DISH, and that investigated vitamin D supplementation on systolic hypertension, people with elevated blood pressure. And there was no difference in 3 months. It was vitamin D versus placebo. So no difference in blood pressure in 3 months. So that study was halted early. Now, we always like to look at studies like, is there some reason that this study didn't work? We thought it should. Why didn't it work? Turns out that the vitamin D level achieved with supplementation was still pretty low. The vitamin D level only went up to 28, and we know you got to be at least 30 to not be vitamin D deficient. So the study was a little bit flawed, but interesting nevertheless. Here's an interesting study because vitamin D is linked to sunlight. So this study was called Daylight. And they took people with what we call pre-hypertension, people close to having full-blown hypertension, or stage 1 hypertension, which is mild. And they also had vitamin D deficiency. And that study was stopped early because there was no effect of vitamin D supplementation. So again, sort of a not very good result for vitamin D in high blood pressure.
Right. So the enthusiasts for any of these would then criticize them, and it's a legitimate criticism because we want to get the real answer. We want to know the truth. So as you already highlighted, just to summarize for our audience, was the vitamin D enough to get you to a high enough level? We're using a number of 30, but even that's sort of a made-up number. Maybe we need to go to 40. There's other criticisms that have been made, the type of vitamin D. There's 2 different kinds of vitamin D, the way that our body uses it in the kidneys. So some people have criticized, well, they use the wrong type of vitamin D. They also sometimes have criticized that the studies have included patients who have had vitamin D levels that aren't as low as they should be. So if you compared really low versus not so low. So these are all criticisms that are legitimate. And as you said earlier, it takes a huge amount of research, effort, and numbers of patients to really get at the truth.
Right, because the differences are very small.
Right.
There's a medical journal called The Lancet, which publishes a lot of interesting articles. They reviewed a lot of the vitamin D literature. Their conclusion was that vitamin D supplementation does not necessarily prevent heart attack, stroke, cancer, or bone fractures. So the data is very limited. They made another point that no study came close to establishing what we call relative risk difference of more than 15%. In other words, can we show that by whatever intervention we're doing, by whatever medicine we're giving you, that we've reduced your relative risk compared to other people by 15%. So we're not even close. They said, we're not even close, and we don't think that any other studies are going to really get us there, that we may have already done all that we need to do.
So that's a really interesting point, because I didn't mention one other potential criticism of these studies would be the duration of the study. Mm-hmm. So, of course, we're Americans and we want it done yesterday. So we want to give a drug and see an effect in a year. But maybe the cumulative effects of vitamin D deficiency, I'm not arguing this point, I'm just saying it's reasonable to ask, maybe you really have to supplement people for 10 or 15 years. So maybe you look at a guy at age 35 and you look at him at age 50 and you say, well, over 15 years, one group had good levels of vitamin D, the other group did not have good levels of vitamin D. That might be something that we'd like to know the answer of, but who's going to fund that study? Sometimes the answers we desire, we will never get because there's no way to actually get the answer.
Right, so for bone fracture, of course, so if you start people who are 60 or 70 years old on vitamin D,
it may be too late.
It may be too late, but if you start somebody at 35 or 40, maybe that would be great.
So these are questions, I could come up with a dozen great questions in vitamin D because I'm interested in this subject, but I don't think we'll ever get most of the answers. And I didn't know the Lancet review you just said. It's disappointing to hear that they said we're already done, because that would be an incentive to not pursue more research.
Exactly. And as I go through, we see a lot of patients in consultation and we go through their lab studies, and almost everyone has had a vitamin D level drawn. So tremendous amount has been spent on vitamin D levels, and we're not sure if we're helping them by knowing it and treating it. Interesting. So just shifting gears a little bit, I have some information about something called fatty acid supplementation in the delivered via fish oil.
Well, that can't be good because it's got fat and acid in it, and those are not good for you. So fatty acid, tell us about that.
But we've got a lot of people out there taking fish oil supplements, and they get what's called free fatty acids from those. So there were 2 studies that were done recently that casted some doubt on whether or not these supplements are helpful. People did an analysis of 27 randomized controlled trials on fatty acid supplementation. So a randomized controlled trial is a really good trial.
And this is, just for our audience, this is really, they should be thinking about fish oil and flaxseed oil supplements. Is that what you're thinking?
That's right. Okay. That's right. So a randomized study means that people are put into, they fit criteria for the study, but they're randomly put into one group or the other. We don't know.
Stuff or the fake
right,
stuff.
and we can't bias it. So it's all done. Perhaps it's a cute computer algorithm.
Or a flip of a coin.
So there were, in this review of 27 reasonably good studies, there was no evidence that fatty acid supplementation was associated with cardiovascular risk reduction. Interesting. There was another study run through the NHLBI, that's the National Heart, Lung, and Blood Institute in Washington, D.C. And it was an eye study. And what they showed was no reduction in risk for cardiovascular disease with supplementation with omega-3 fatty acids. So we got a lot of people taking those supplements and not a lot of good evidence that it's helpful.
So what is tell me what you've been telling your patients.
Well,
I've been telling my patients, I have highlighted that, and now I'm telling every one of the patients to just not continue them.
Yeah, on a personal level, my sister called me the other night, says, I just saw this ad for krill oil, which is a more purified type of fish oil. And I've been taking regular old fish oil, but I think this may be better for me. And I said, well, I hate to deflate you, but there haven't been a lot of great studies that show that fish oil is beneficial. So if I were you, I wouldn't take it. You're already on a statin for cholesterol control. You've got great numbers. Your blood pressure is great. You're exercising.
And eat fish.
That's right.
Twice a week, eat fish.
Yeah. So I said, I wouldn't take it.
Okay.
Here's another interesting study. This is actually a local study. It's called VITAL. It's led by researchers at Brigham and Women's Hospital. This is a very, very big clinical study. They have enrolled 25,000 patients, men and women over 50, without any previous history of cardiovascular disease or cancer. It is a randomized, double-blind, placebo-controlled clinical trial. That's the kind we like. Those are the best. Patients are randomly assigned to a particular treatment arm. It's double-blinded, so the researchers and the patients don't know who's in what group, so we can't bias it. And it's placebo-controlled, meaning it's the real thing versus a fake. So their plan is to examine vitamin D and omega-3 fish oil for the prevention of cardiovascular disease and cancer. The results are not in yet. So looking toward that study. That's a very big, robust study, and we'll see how that one comes out.
Okay, but again, the same potential criticisms, even in that study, they're using a kind of a lower dose. Than a lot of times our patients need a higher dose to get to 30. So I'm not criticizing it, just we hope that it'll give us some good
And
answers.
they're older, they're not old, but they're older adults, they're over 50. So again, the argument that maybe we need to start this at a younger age. So the debate continues. Some feel that enough studies have been done. We've seen some potential harm from beta carotene. We know that high intake of some vitamins could be harmful, so enough is enough. And we also know that large-scale studies are very, very expensive, and how many times do we need to do the studies? So that's the negative side. The positive side is, as you've pointed out, maybe we need a different paradigm. Maybe we're not doing it the right way. Maybe we're not starting it early enough. Maybe the doses aren't high enough. Maybe we're looking at the wrong supplement. So that's the side that says, let's do some more of these. So what do I think we ought to do with our patients when we see them in the office and we discuss this? And I do try to keep an open mind. I hope I don't come across as anti-vitamin, but I like to have a frank discussion about it. So I think we need to tell them that some of these vitamins and supplements that you take might interact with some of the medicines that you're taking. So they could potentially be hazardous. So for example, we have a lot of patients on warfarin. You just presented that very nice talk about atrial fibrillation guidelines and the need for blood thinners. So patients on warfarin who are taking coenzyme Q, which is a supplement that people think helps heart health, that interferes with warfarin. So it may put you more at risk for stroke. Fatty acids can increase the tendency for bruising, so that's a potential downside. There's another very popular supplement. I haven't heard that much about it lately, but I had in the past St. John's wort. One of the problems with that is it interferes with one of our major metabolic pathways in the body. So it can affect a number of medications that patients might be on. So there's some of the potential harm. So what I think we should tell people is don't let this supplementation stuff distract you from a healthy lifestyle, a healthy diet, exercising, eating well, controlling your portion size. Those are the things that we know that work. And as you pointed out earlier, the process for manufacturing vitamins is not very strong. There's not a lot of oversight, so you don't know exactly what you're getting in these supplements. So the good news, for the most part, the extra supplements aren't going to hurt you. There might be a couple of situations where they could be harmful. The bad news, the data is insufficient, no clear benefit from these. And the concern that taking the supplements will turn people away from the healthy lifestyle. And I'll end with what I thought was kind of an amusing quote from one of the researchers that said, because we're a very prosperous country, that Americans continue to have the most expensive urine in the world due to the relatively high consumption of vitamins. Most of these vitamins just spill right over into the urine because we just don't need that much of them. So a lot of people are taking them and just unclear. And I hope some of the future studies will enlighten us as to whether it's something we should be recommending or whether we should be discouraging.
Yes, I think it's a really great overview. And I don't know, this will be on YouTube in 20 years, and people may look back at this and say, we were fools because, of course, we should have been using some kind of vitamin that we're not currently using. But we have to play the ball as it lies, as they say in golf. We have to use the current data. And the current data, as Dr. Adams has really beautifully outlined, is that there is really no evidence currently for vitamin use, generally speaking, and there are potential hazards. So possible harm, no definite benefit. At this point, at least don't use it as an excuse not to do the right thing with regard to eating right, exercising, and trying to keep trim. So I guess those are the highlights that Dr. Adams provided that I would really want to strongly emphasize for our audience. So thanks for listening to us about vitamins and cardiovascular disease. Until next time, I'm Seth Bilazarian from Pentucket Medical Associates, bringing you another episode of Matters of the Heart on Haverhill Community Television. Thanks for joining us.